Spinal disorders can be a little bit complex for a lot of doctors without a background of spine disorders. Basically, when Dr. Minucci sees a patient and he suspected possible nerve impingement or any compression of the nerve, he referred that patient to me so I can perform nerve conduction studies, or EMG. This could happen before surgical intervention, just to evaluate if the patient basically needs surgery or not. Sometimes it's an impingement of the nerve that is not coming from the spine of the patient, and there is some other ways to correct that problem. After surgery, the patient sometimes they might complain of some numbness or tingling, which sometimes is not associated with the surgical procedure, is just further compression of different nerves. And that's what we do. We perform EMG nerve conduction studies to evaluate any nerve or muscle disorder. EMG is basically electromyography. Is a study that we do or perform on patients. It's been in use since 19th century. Basically from the past 30 to 40 years, it's been quite common for the patients to get that particular test. Basically, we use this computer-based machine in which we add simple electrodes in key muscles of the patient's hands or leg, and we try to stimulate that nerve. Basically, when we stimulate the nerve, we're measuring how fast the current goes through that nerve and how well the current or the stimulation reach that particular point. That's the first part. The second part, we use a tiny needle in which we insert the needle in each muscle, and we try to capture that abnormal signal, if there is an abnormal signal, from the muscle. Well, basically, we can perform diagnostic injections, epidural steroid injections. Also, sometimes the patient is not the spine, is in relation to other musculoskeletal disorders, like problems in the shoulder, problems in the hip, in which we can perform injections here in the office. Also, the patient might need physical or occupational therapy, in which I perform the prescription for that particular patient, and they go and get rehab.